So then what brought you back to Covington?
Well, it's like the old saying, everybody who ever lived here, they always come back. So, but it's just a unique place. Now I've lived in the Midwest, I've lived in the Northeast, I've lived in the Florida, I've lived in San Francisco, the West Coast. I've lived kind of all over, and they're all great. But I'd say that we kind of have a unique community here. It's very different. It's hard to explain to other people who've not been here, but it's definitely, being so close to New Orleans, but yet having our own little kind of bubble here on the North Shore, we're kind of unique. And I haven't really appreciated that everywhere else that I've lived. And so that's the big reason. I have a lot of family here as well, and I grew up here, so I have a lot of emotional reasons to come back as well.
Very
So
cool.
that's kind of what brought me back.
So I said you are working at St. Tammany, but where exactly is your office located?
So our office, the actual address is 71211 Highway 21 in Covington. It's basically on Highway 21, like you're heading up towards St. Tammany Hospital, about a mile before you get to the hospital. It would be on the left-hand side if you got off the interstate heading toward the hospital. We're, just kind of, the closest thing I could think of, there's a Firestone tire place right past if you passed our place, you're going to see that on the left. So we're kind of all in that area that's being developed, where the road is widened now and everything else, but that's our office.
Awesome. So what type of patient do you see mostly? I mean, I know you said you have done your fellowship in total shoulders, so I'm guessing shoulders, and what else do you like to do?
Sure.
The most?
So I see a lot of shoulder and knee complaints are the most of what I see. Taking general call, I do see fractures. We see a lot of hip fractures, obviously. Some of your older patients, you get those. But I see a lot of shoulder complaints more than anything. And then I see a lot of knee complaints, and I see everything up to knee arthritis. I do some knee replacements, and I also see everything through shoulder arthritis and people who've had shoulder replacements already. So that's kind of the scope of what I see. I also see kids. I do that more in conjunction with our pediatric orthopedist, Dr. McDaniel, because I did in my sports fellowship, I did a lot of pediatric sports training, and a lot of what she did was more pediatric trauma and spine and whatnot. So she doesn't do a whole lot of arthroscopy, so we work together. So almost any patient that needs an arthroscopic procedure or sports procedure as a kid, we work together and we kind of knock it out. Now, I do see kids kind of starting at around 17 and up. She sees them up to 16. So we kind of overlap in that respect. But so kind of a wide spectrum.